Hi, I'm Robb Owen. I was diagnosed with stage 4 head and neck squamous cell carcinoma last October 5th. I chose to follow through with conventional treatment as well as modifying my diet, and I took a supplement regimen that appeared to have been very useful in mitigating my cancer. So when I started treatment in early or late November, my cancer resolved by December 12th. At that point in time, during that time, I had researched about my cancer, about my diet, why I was reacting so well to treatment and the tumor resolved so quickly, to educate myself on what to expect and how to react to the situation. When my doctors told me I needed to continue treatment for another 5 weeks after my tumor had resolved and my blood work shows I was cancer-free, I wrote a preliminary 68-page case study detailing why I was confident that I was basically cured or cancer-free at the time, and used that as basically a confidence boost to tell my doctors that I was done with standard chemo radiotherapy. 7 months later, I'm cancer-free, and during this time, I started researching more as to why and how everything worked together to help defeat this cancer with the success that it's had. And through that research, it led me to Cancer Patient Lab, which is a wonderful opportunity to share information with others that have experienced stage 4 or more challenging versions of their cancers and how they have managed their journey with it. The hope that I have with being with Cancer Patient Lab is the research that I've done to identify all the inputs that aided in curing the cancer that I was dealing with. I've been able to put into basically a blueprint that shows how to beat the cancer with an integrative method of natural alternatives, stress mitigation, diet, and conventional treatment. After compiling the case study, I started working through what I thought, as far as I'm an engineer by trade, and so I used my engineering skills to in the retrospective analysis, and I built a matrix. On the left side of my matrix, there are all the components that are vital to aid in resolving head and neck squamous cell carcinoma. On the top row, or the x-axis, I labeled all the inputs that I was taking, and I kept a very detailed journal of everything that I did during my treatment, and it was a very limited and defined amount of inputs, and I started cross-referencing all those together in this matrix. And when you start populating the matrix, all this data starts jumping out at you as to what the keys I found that were important to being able to defeat squamous cell so quickly. Ascension St. Vincent's reviewed my work, and then they were kind enough to forward it to a couple of doctors at Mayo Clinic's ENT tumor clinic that hopefully are reviewing it as we speak. Ultimately, there may be a chance where this could be used to help others. And the cancer patient groups, or Cancer Patient Lab's ability to connect me with integrative medical oncologists that minds are more open to this type of treatment is a value I cannot put into dollars.